So I'm 2 weeks and 2 days post-operative, and this is the first time that I'm able to walk. Now this is just a demonstration. I'm not allowed to do this, but it's just to demonstrate that I hardly have any pain. It's just a little bit soreness when I'm walking. But what I am supposed to do is that when I'm walking, I have to use this special orthopedic shoe so that I don't put weight on the foot. So instead, this is what I'm supposed to do. I'll just put the shoe. It's a little bit big. So it's a bit clunky, but this is how I'm supposed to walk now for the next 2 weeks. I'll have to be using this shoe, but every time I go to the toilet, it's a little bit annoying to put the shoe constantly. So what I do instead is that I just use one crutch, walking, and just not putting too much weight on this foot. So yeah. So I am 2 weeks and 6 days post-operative. I had my bandage got a bit wet. It was an accident in the shower where it got wet, so I had to take it off, but it's not really a problem because the wound is healed. So this is what it looks like. Tomorrow I'm getting my stitches removed. Oops. Yeah. As you can see, there still is a bit of some oozing, a little bit, but mostly it's closed. But this is basically what it looks like now. And tomorrow I'm getting the stitches removed, which is nice. And on the back here, where I got the screws removed from my heel fusion 2 years ago, I have a bit of stitches here. That's what it looks like. This one, of course, was much less invasive, so it looks much better. A bit of skin peeling, but that's alright. So it'll be really nice to get these stitches off. I have had a little bit of pain around this area here occasionally in the last 2 weeks or more. I've only 2 times taken some painkiller because it was very painful, but it has been very, very seldom that I've had pain around this area here, but generally no pain anymore. So this is the first time I'm going out to a restaurant. I've only been out of my apartment once in the last 2 weeks and 6 days to the doctor, to the nurse, and so I'm able to walk a bit now. It's a bit hard to walk down the stairs. It's such a big sheet. Post-operative, and I can finally walk again with normal shoes, and I can get down the stairs, no problem. It's a bit sore around the ankle area because my muscle has atrophied, so the ankle area is a little bit weak. So I need to build up that muscle again. Så bare stop. Ved siden af. Alright. So, post-operative, as I mentioned, 4 weeks. I can finally walk again. I still feel like, because I've been limping for 2 years, so I kind of have to get used to that I don't really have to limp that much anymore. But in a way, I do just a little bit now because it is still a little bit sore around the incision area of the big toe. So it's not like 100% healed yet, so it's gonna take a few more weeks, but you know, this is good progress. I can walk again normally. So oh, and I just wanted to say, when I say sore around the big toe area, I don't mean that it's sore when I'm just laying down or sitting down. It's more when I've been walking a bit, just a little bit. It's just a little bit uncomfortable. It's not bad. It's not like it hurts or anything like that. So it's pretty fine. So, hi guys. So this is about approximately 1 year and a few months later after my last surgery. I had the last surgery that I had was the fusion of my toe, and before that I had a bunion on my left foot, and it's going really good. I'm doing really good. I've been really happy about the surgery. The surgery was very successful. I want to talk a little bit about what it was like the first few days. So the first few days I was in excruciating pain. I took oxycodone 5 milligrams every 3 hours or so, and I was very constipated, so I had to take laxatives. So that's a really important part of the whole process. But other than that, it healed really well, and I can show you what my toe looks like now. The only issue I have with the fusion on my left foot, on my right foot, is that I developed a kind of a sesamoid bone that sticks out a bit, so I don't like walking barefoot. So I use MBT shoes, which are really good, and I walk really pain-free on these shoes here, and they've been really good for me, and they're equivalent to Hoka shoes. And so this is basically what I'll show you what my, let's see here. So this is the fused toe. As you can see, I can't really bend it upwards, but it's on a circa 30 degree. I have a callus here. That's nothing. It's not really a problem. But yeah, this is what it looks like. And on my other toe, where I had the bunion done, I had a lapidus procedure. This is what it looks like now. You can still see the scarring a bit, and I can bend my toe about this much. So I don't really have problems walking, so I'm quite happy about that. So that's kind of the update of how it's been going for the last 1 year and about 3 months or so. No, 4 months. 1 year and 4 months. Because I shattered my heels almost 4 years ago, I can only walk about 10,000 steps, or a little bit more sometimes. But that has nothing to do with my toes. That's because of I shattered my heels. But in regards to having this surgery, the bunion surgery and the fusion surgery, it's been absolutely a success, and
I'm really happy about it. I'm able to walk around and pain-free, and I don't have any more issues with my toes anymore, besides the fact that there is the sesamoid bone that's sticking out a bit on my right foot where the fusion was done. But and I don't like walking barefoot, and so I just use shoes, and it's fine. It's not a problem. I don't feel it. So yeah, this was just the update.